What are the main causes of sensorineural hearing loss? Valentine's gifts can break, flowers wilt, chocolates disappear. But sensorineural hearing loss, that's permanent. And most people don't even know what caused it until it's too late. So, what really causes it? The answer might surprise you. First, let's understand this clearly. Sensorineural hearing loss happens when the inner ear or the hearing nerve gets damaged. Not blocked, not infected, but damaged. And here's the shocking part. Once those tiny inner ear hair cells are destroyed, they don't grow back. Now let's talk about the real causes. Loud music, headphones at high volume, traffic, factories, firecrackers, even just a few minutes of extreme sound can permanently damage inner ear cells. This is the most common cause of sensorineural hearing loss worldwide. And the scary part? You won't feel pain, you'll just notice speech getting unclear over time. Yes, age related hearing loss is real, but it's not just getting old. Over time, the nerve pathways between your ear and brain weaken. It becomes harder to hear conversations in noisy places. That's classic sensorineural hearing loss progression. Sudden sensorineural hearing loss can happen after viral infections, sometimes overnight. One morning, hearing is normal, next morning, it's reduced. This is considered a medical emergency. Some people are born with inner ear sensitivity. Hearing may slowly decline in their 30s or 40s without obvious noise exposure. Certain antibiotics, chemotherapy drugs, high dose pain medications, they can damage the cochlea. Most people don't even know this risk exists. A fall, an accident, even a sports injury. Physical shock can damage the hearing nerve. Here's what most people don't realize. Sensorineural hearing loss isn't just about hearing less. It's about the brain receiving weaker signals. When the brain adapts to less sound over years, speech clarity drops, even if volume seems okay. That's why people say, I can hear, but I can't understand. And that's the turning point. The biggest cause? Delay. Ignoring early symptoms. Waiting too long for a proper hearing test. Because the earlier sensorineural hearing loss is detected, the better the management outcomes. If you've noticed subtle changes, difficulty understanding speech, or sudden hearing shifts, don't wait. At Hearzap, comprehensive hearing tests help detect sensorineural hearing loss early, so you can protect both your ears and your brain. Book your hearing evaluation today, because what's silent today can become permanent tomorrow.